Welcome. Please kindly subscribe, share, and like this videos for health matter. A stroke occurs when the brain's vital blood supply is suddenly interrupted, depriving brain cells of oxygen and nutrient. This critical event can lead to severe and lasting consequences, impacting various bodily functions. Immediate medical attention is crucial to mitigate damage and improve recovery outcomes. Recognizing the warning signs of a stroke can be life-saving, preventing permanent disability. A stroke occurs when blood flow to a part of the brain is either blocked or a blood vessel ruptures. This interruption deprives brain cells of vital oxygen and nutrients. Consequently, these brain cells begin to die rapidly. The specific effects of a stroke depend on the affected brain area and the extent of damage. A stroke occurs when blood flow to the brain is interrupted or reduced. This deprives brain cells of oxygen and nutrients, leading to cell death. There are two primary types of stroke: ischemic and hemorrhagic. Ischemic strokes, the most common type, 87%, result from a blood clot blocking brain blood flow. Hemorrhagic strokes occur when a blood vessel in the brain leaks or ruptures. This causes bleeding into the surrounding brain tissue, damaging cells. Ischemic strokes often originate from atherosclerosis, a condition where plaque accumulates in arteries. This plaque buildup narrows the arteries, making them susceptible to clot formation. When a clot forms or travels to a brain artery, it can completely obstruct blood flow. This obstruction leads to an ischemic event, depriving brain tissue of oxygen and nutrients. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures, leading to bleeding. One primary cause is uncontrolled high blood pressure, also known as hypertension. Over time, high blood pressure weakens the walls of blood vessels. This weakening makes the vessels more susceptible to tearing or bursting. Another significant cause is the rupture of an aneurysm. Aneurysms are balloon-like bulges in blood vessels that can burst and cause bleeding. High blood pressure, medically known as hypertension, is a significant health concern. It is identified as a primary risk factor for both ischemic and hemorrhagic strokes. Consistently elevated blood pressure exerts excessive strain on the walls of blood vessels. This sustained pressure increases the likelihood of damage to these delicate vessel walls. Such damage can lead to vessel rupture, causing hemorrhagic stroke or clot formation. Clot formation can block blood flow, resulting in an ischemic stroke, the most common type. High cholesterol levels are a significant health concern, impacting cardiovascular health. Elevated cholesterol contributes to atherosclerosis, a condition where arteries harden and narrow. This narrowing is caused by plaque buildup on the inner walls of blood vessels. Atherosclerosis significantly increases the risk of ischemic stroke, a severe cerebrovascular event. An ischemic stroke occurs when blood flow to the brain is blocked, often by a clot. Effective management of cholesterol levels is crucial for maintaining vascular health and preventing stroke. Diabetes significantly impacts overall health, including cardiovascular systems. It can cause damage to blood vessels throughout the body. Damaged blood vessels become more susceptible to narrowing. This narrowing increases the likelihood of clot formation within the vessels. The presence of clots elevates an individual's risk of experiencing a stroke. Therefore, effective management of blood sugar levels is crucial for stroke prevention in diabetic patients. Smoking significantly impacts cardiovascular health, increasing the risk of severe medical conditions. It causes damage to blood vessels, making them less elastic and more prone to injury. Smoking also leads to blood thickening, which can impede proper circulation and oxygen delivery. Furthermore, it accelerates plaque buildup in arteries, a key factor in atherosclerosis. These combined effects substantially elevate an individual's risk of experiencing a stroke. Atrial fibrillation is an irregular heartbeat that can lead to serious health complications. This irregular rhythm can cause blood to pool in the heart, leading to the formation of blood clots. These clots can then travel from the heart to the brain, causing an ischemic stroke. Effective medical management of atrial fibrillation is crucial to prevent stroke and other complications. Recognizing stroke symptoms quickly is crucial for effective intervention and improved outcomes. The F.A.S.T acronym serves as an easy-to-remember guide for identifying key warning signs. F stands for face drooping, indicating a sudden weakness or numbness on one side of the face. A is for arm weakness, where one arm may feel numb, weak, or drift downwards. S is for speech difficulty, characterized by slurred speech or trouble understanding others. T is time to call emergency services. The acronym F.A.S.T is a mnemonic used to identify and respond to stroke symptoms. The F in F.A.S.T stands for face drooping, a critical indicator of a potential stroke. Observe if one side of a person's face appears to droop or feels numb. To assess this symptom, ask the individual to smile. An uneven or lopsided smile is a strong indication of facial muscle weakness. This asymmetry suggests a potential stroke and requires immediate medical attention. The acronym F.A.S.T helps identify common stroke symptoms quickly. The A in F.A.S.T stands for arm weakness, a critical indicator of a potential stroke. To check for arm weakness, ask the individual to raise both of their arms simultaneously. Observe if one arm involuntarily drifts downward, indicating a loss of strength or sensation. This downward drift suggests weakness or numbness, a common and urgent stroke symptom. The S in the F.A.S.T acronym for stroke recognition stands for speech difficulty. This symptom involves a noticeable change in a person's ability to speak clearly. To assess this, ask the individual to repeat a simple, common sentence. Observe if their speech is slurred, garbled, or if they struggle to repeat the sentence correctly. Such speech impairments are a critical warning sign indicating a potential stroke. The T in F.A.S.T stands for time to call 911 immediately. Prompt medical attention is crucial during a stroke event. Every minute counts in minimizing potential brain damage. Rapid response significantly improves patient outcomes. Beyond common indicators, certain stroke symptoms are less frequent but highly severe. These include a sudden, intense headache with no identifiable cause. Another critical symptom is abrupt trouble seeing in one or both eyes. Sudden dizziness or an unexpected loss of balance also signal a serious stroke. A healthy diet is crucial for reducing the risk of stroke. Consuming fruits, vegetables, and whole grains supports cardiovascular health. Limiting saturated fats, trans fats, and sodium is essential. This dietary approach helps control blood pressure and cholesterol, lowering stroke risk. Regular physical activity is crucial for maintaining overall health and well-being. It involves engaging in moderate-intensity exercise for at least 30 minutes. This activity should ideally be performed on most days of the week. Consistent exercise helps in maintaining a healthy body weight. It also contributes to lowering blood pressure and enhancing cardiovascular health. Ultimately, regular physical activity significantly reduces the risk of stroke. Managing existing medical conditions is crucial for stroke prevention. This includes conditions like high blood pressure, diabetes, and high cholesterol. Adherence to prescribed medications and regular doctor visits are key components. Consistent treatment plans significantly reduce the risk of stroke. Acute stroke requires immediate medical intervention to mitigate damage and improve patient outcomes. Treatment strategies are determined by the type of stroke, primarily ischemic or hemorrhagic. For ischemic strokes, the goal is to dissolve blood clots, obstructing blood flow to the brain. Medications, such as thrombolytics, are administered to achieve this clot dissolution. In cases of hemorrhagic stroke, treatment focuses on repairing ruptured blood vessels. All acute stroke interventions must be initiated within a critical and narrow therapeutic time window. After initial medical treatment, rehabilitation is crucial for stroke survivors. The primary goal of rehabilitation is to help patients regain lost functions and improve quality of life. Rehabilitation programs are highly individualized, tailored to each patient's specific needs and deficits. Physical therapy focuses on restoring motor skills, strength, balance, and mobility. Occupational therapy helps patients relearn daily living activities, such as dressing and eating. Speech therapy addresses communication and swallowing difficulties. vital for recovery. Long-term stroke management focuses on preventing future cerebrovascular events. This involves diligent control of various risk factors that contribute to stroke recurrence. A key component is continued adherence to prescribed medications as directed by healthcare providers. Lifestyle modifications are crucial, including dietary changes, regular exercise, and smoking cessation. Regular follow-up appointments with healthcare professionals are essential for ongoing monitoring and adjustments. This video is strictly for educational purposes and general information. It does not offer medical advice, diagnosis, or treatment recommendations. Always consult a qualified healthcare professional for medical concerns. Seek professional guidance before making any health-related decisions. Empower yourself with essential health knowledge. Share this vital information with your loved ones. Help spread awareness about critical stroke warning signs. Understand the importance of acting F.A.S.T in a stroke emergency. Collective awareness can save lives and improve outcomes. Subscribe to our channel for exclusive access to professional health education. Receive weekly video content designed to enhance your health knowledge. Stay informed on a wide range of critical health topics and advancements. Our educational resources are curated to support your personal health journey. We prioritize providing accurate and timely health information. Join our community to empower your health decisions and well-being.